I'm very happy to be here with my colleague Oscar. This is the culminating session of our first year of our community of practice, and we've had a lot of experts leading up to us, so I want to just go on the record that Oscar and I are not here as experts of any sort, but really as fellows and as colleagues with all of you in a learning community. Our project that Oscar and I have been working on for the last year through the California Leadership Academy for the Public Health is all about community resilience, how to create an equitable and resilient community. So I've been very interested in how can we take what we've been learning in this community together around the neuroscience, the epigenetics, adversity, and resilience, and scale that up at a community level. How can we support each other to think about how do we ripple this out into our community? So Oscar and I are going to tell you a little bit about our journey over the past year. And we're going to ask for some feedback from all of you around how can we reimagine how we come together as a community, and how can we continue to expand this work out into the community. So first, I'm going to just talk a little bit about community resilience. I'm going to introduce the self-healing community model, and then I'll tell you a little bit about our leadership project. I have a copy of the journal article here if you haven't read it yet. It's called SelfHealing Communities. You can Google it. It was put out by Robert Wood Johnson about a year ago in June 2016. This is the first copy. I have many, many copies of this, and I've handed it out to many people. This is the copy that has coffee spilled all over it, because I was sitting at a coffee shop talking to Traythan Heckman from Daily Acts about it. We got so excited, we were just going a lot of hand gestures, and then the coffee flew everywhere. So this is my coffee that I keep close to my heart. It reminds me of the excitement I felt when I first read it. I'm going to start with a few quotes. One is from the early 1900s and one is from the early 2000s, but both really resonated with me as I've explored some of the issues we're discussing today. So here we have Theodore Roosevelt. Should you have a fifth son, you might consider the name Roosevelt, right? This country will not be a good place for any of us to live unless we make it a good place for all of us to live. So he was our 26th president. He was, I think, the youngest one at about age 42, and he focused a lot on fairness for the average citizen, and worked on breaking trusts, regulation of the railroads, keeping our food and drugs pure. And I just find it nice to remember that we do have a history of leaders who care about equity and resilience. And this is a quote from Rob Hopkins, who's the founder of the International Transition Towns movement. And he says, if we wait for governments, it'll be too little, too late. If we act as individuals, it'll be too little. But if we act as communities, it might just be enough, just in time. And again, this really resonated with me. I'm a member of the government. I love being a public servant, but our processes are slow, and we don't have enough resources. And so I really love this idea of what we can do as a community. Okay, so community resilience. Nancy talked a little bit about, and Sue talked about a little bit about individual resilience and the factors that go into individual resilience. Community resilience is used at all levels, federal, state, local levels, and across all sectors. And traditionally, it's related to a sustained ability of a community to withstand and recover from some adversity. I don't know if you can see in this picture, we've got the 1918 Spanish flu epidemic. This is an emergency hospital that was set up in Kansas, and this is what might happen here. Our vets halls could be turned into something like this if we were to have some kind of outbreak. And then we have the Santa Rosa City Hall there. So typically it's been to some kind of resilience referred to withstanding from that kind of natural disaster or pandemic. I started noticing in my work that I'm at many different tables. There's many different coalitions and initiatives and organizations that are all working towards some version of community resiliency, but often using different vocabularies, different frameworks, different metrics. Some are focused more on health equity or social justice. Others are focused on the need to preserve and regenerate natural resources. Others are focusing on our economy. How do we keep our economy diverse and resilient to whatever shocks might happen in the economy, throughout the nation? So I found myself being at all these different tables, and at the intersection of all these initiatives and conversations, I began to see a common thread. And I looked at the literature, and I worked to understand what's at the core, what's at the root of these various community problems, and I began to see this sort of common thread that leads to greater resiliency, and it's basically community connectedness. That's a lot about what we've been talking about in this group, in our learning community, is how important it is to be connected. And it was clear people are healthier and do better in neighborhoods where they're connected and empowered. And where we have strong networks of connection, people can provide the critical support that's needed. And that really resonated with me. I was in San Francisco in 1989 during the Loma Prieta earthquake, and I was living in an apartment building where I basically knew no one. My husband and we moved in there, I didn't know anyone. And after the earthquake, it was terrifying because it was a new building and our building was built on landfill, so the building really moved. And I didn't know anyone, and went out in the halls, and it was just like a bunch of strangers. It was very, very odd. But I did have a friend from a previous neighborhood where we had stronger networks of connection who rode his bike over and brought me a radio and a flashlight. And my husband didn't make it home that night. He had taken the train down to the peninsula. But just knowing that I had someone that knew I was there and cared about me made me feel much safer and helped me survive. We were the last neighborhood to get electricity and gas. But anyway, that's sort of my personal experience about community resiliency there. So this is where the Self-Healing Communities model comes in. As the Department of Health Services got a grant in 2015 called Mobilizing Action for Resilient Communities. And we're one of 14 communities across the nation that was funded to explore how to use this near science, the neuroscience, the epigenetics, adversity, and resilience to build resilient communities. And that's where I first found out about the self-healing community model. There's monthly webinars, and Laura Porter presented on the self-healing community model. I can't remember if she presented with anyone else or if it was by herself. I think she did by herself. But I was just really taken aback by it. It spoke to me, having been at all these tables, having worked on health improvement projects in very siloed ways, whether it was pregnancy prevention or tobacco prevention or HIV prevention or preparedness. I was very much impressed at the results that they had simultaneously in that community. They brought down all of their indicators. Oh, I haven't been switching, sorry. Anyway, this is a logo from one of our sisters in the 14 communities, Tarpon Springs, and they were on the webinar this week talking about their experience. And I show this. This is a what do you call it? A logo for their town that they adopted, and it's the red mangrove. It says a resilient community, the red mangrove. And so they've rippled this out, this whole concept of resiliency, and have it symbolized on their city logo. So I thought that was neat. So I wanted to put that on there as a shout out to them. Okay, so Cowlitz County is the county that's described in the Self-Healing Communities article. And it's a county that has suffered a lot, has a lot of shocks and trauma that it experienced. This is Mount St. Helens, erupted in the 1980s, actually in 1980. They had industries that many, many years of decline, their timber and fishing industries. They had some large manufacturing plants that closed down. And actually that was where there was a very large landslide in 1998. Is it Reslow? Keslow, one of the largest landslides in the nation. But they benefited from the support of the Washington Family Policy Council that basically, with the understanding of the near science, what we've been talking about, and with the understanding of systems theory, which is basically things are chaotic, things affect each other, you can't just go linearly and solve problems. So embracing the near science and the systems theory, the Washington Family Policy Council shifted their theory of change and how they support communities and work with communities. And they really encouraged they encouraged the communities to build strong networks of connection, to work in ways that would enable rapid response, to correct courses when needed, to talk to one another, to share their problems and ideas, and basically get involved in problem solving. And at the heart of this is connection. So we're seeing this theme about connection between the numbers and types of relationships, between the types of people that you're working with, and encouraging people to find their own strengths to solve their own problems. What really got my attention was the results. I could not believe it. They had births to teen mothers reduced 62%, infant mortality reduced 43%. This was over a number of years. Suicide attempts down, youth suicide and suicide attempts. And so it was extremely cost effective also for, I think they said, for a budget of about $8 million, this is over a large area, they ended up saving $55 million in 2 years just by reducing the rates of all these problems, caseload prevented. And so what I found was truly transformational here is that it's really based on the science. We've spent all year learning about this science, and so this is an effort to take the science and put it at the base of how they're working with the community. It's not about politics, it's not about ideals, it's not about a new governor or a new president, it's about the science. And so I think that's something that we can build on here. This is a slide that Laura Porter and Rob Anda have used quite a bit. I like showing it. It shows the gears of sort of action in a community. And all of us have some role in the community. I'm in the health system. You might be in the school system, criminal justice system. But you can see they have the largest gear is the population, the people, the population that is affected by ACEs. And most people are affected by ACEs. And so their main philosophy in the self-healing community model is that the grassroots are the primary agents of change. I found this video of Dr. Anda, and I just loved what he said. He was speaking up in Canada probably 5 years ago. So I rewound it until I got verbatim what he said. So I'm going to read it to you because I just really liked it, and it speaks, it's his words. He says, "We need to trust the people who've been affected by adversity to take this information," and he's referring to ACEs, "and use it to change their own lives and the lives of the next generation. There's not enough money, there are not enough service organizations to do this, because the scope of this problem is so large that we have to trust the people who have been affected and trust people in communities to use their resourcefulness and their own vision and creativity to heal." And so they say repeatedly in our training and elsewhere that it's the only way, really, that we're going to develop solutions that match the magnitude of the problem. And I definitely feel that I have some of our staff here, and we struggle with the limited number of people we have, and we see the needs are so large in the community. And so I think this is an opportunity where we really, scale up and get more people involved to prevent ACEs. And as Dr. Anda says, what's predictable is preventable. So I'll run through, there's 3 main components of the self-healing community model: partners, principles, and process. Partners they describe 3 levels. I won't talk about this too much. The meta leadership is around sort of connectors, those that can link and leverage and knit together social networks that can complement some of the hierarchical power structures. Then there's the local partners, and this is where it's really the community members themselves, and they talk a lot about the importance of having a paid local coordinator, and then a core team of community members that can be relayed on. And I think of great folks in our community that are doing this work, Aaron and Jacob, who are coordinators of these great efforts out in the community, and how we need to support them and continue to find ways to support their work. So there's the local partners, and then external partners, which would be funders, evaluators, educators, maybe bringing in experts from time to time to bring in content, but basically supporting the capacity building processes so that the community itself becomes stronger in the process. The next component is principles, and this is the part that I think is the most important. It really speaks to the integrity of the model. And it's all about inclusion, respect, and mutual support. So whether or not these 6 speak to you, if you are constantly thinking about inclusion, respect, and mutual support, you'll get the gist. But the 6 that they lay out, and I think we translated these into English a little bit, but inclusive leadership with downward accountability, where leaders we're always expanding who's considered a leader, but once you have stepped up into that role, that you're really always listening and building trust, and also being able to acknowledge the role that we may play ourselves in the status quo, in dynamics that continue to produce status quo outcomes. The second principle is learning, and that I think is one of the key ones, is constantly learning. How can we be open to learning, iterative cycles of change that then lead to action and evaluation and then ongoing iterations. The next one is emergent capabilities, which to me is all about being nimble and flexible and being willing to adapt. And they give some examples of ways that they've encouraged new lines of communication. They talk a lot about self-organizing networks, things that sort of just pop up out of the opportunity of the moment and who might be around, and the ideas that emerge, peer support systems. A lot of flexibility and spontaneity that can accompany our more formal services. The next one is what we've called inclusion and compassion. In the article, they call it near-informed engagement. So for those of us that have been talking about the near sciences, we know what that means, but we've been trying to just use plain English. And so it's around inclusion and compassion, and that's really appreciating the core gifts that everyone has, while also recognizing that participating can be difficult for some people. And so how do we create safety, and how are we welcoming so that everyone can participate? And so that takes thought to design processes that make that possible. The next one is right fit solutions. So that's looking at being open to ingenious solutions that match the resources that are available in a community, and not necessarily taking strategies or approaches that may have worked in New York City, but really maybe don't build on what we have here, the resources that we have here. And then finally, hope and efficacy. So noticing and supporting when things have gone well, and sort of building that virtuous cycle. They talk about this as being, oh no, this is the principles, that comes next, sorry. But what else did I want to say about this? Oh, Elizabeth out in the back, our lovely intern who's really supported our process here. I noticed in a blog that she wrote, I really liked it. She talked about the SelfHealing Community article, and she said, you may be wondering, is this model sustainable? And I like that she highlighted that about the article. And it is, what's so great about this is it is sustainable because it's focused on building community capacity. It's not about implementing a program or getting a specific outcome, but it's about building a community so that it's stronger, so that it can basically deal with whatever comes its way, whether it's the earthquake, which will come at some point, or whether it's some kind of disease, or whether it's some kind of other social trauma. So back to Roosevelt. I wanted to highlight this as an example of someone who I admire for his inclusive leadership and with downward accountability. So this is Theodore Roosevelt standing with John Muir in Yosemite. And we know Roosevelt was interested in conservation, but rather than just coming up with his ideas from Washington, he spent 3 days camping with John Muir, and heard directly from him, someone who had very unique knowledge and cared deeply about the need to protect Yosemite Valley. And some of the writings I've read, it's great because he is able to speak to the birds and the air and the stars. And so I think that's something that I'll keep in my mind, is how can I learn from people that are actually living. My office is in downtown Santa Rosa, and I'm always amazed when I talk to people who maybe live in Guerneville or somewhere else, and they have a great idea that I know I never would have thought of from my office in downtown Santa Rosa. Okay. So the next part of the model is process. They have a cycle of 4 main processes they call the rhythm of engagement that just go on and on and on forever. The first one is around, they call it focus, which is about coming together regularly safe and regularly scheduled ways of coming together. Learning, I mentioned learning, networked and interorganizational processes characterized by learning. Results-oriented decision-making, and continuous leadership expansion. So those are the 4 main processes. For those of you that have been in the fellowship and have been trained and are out speaking to people, I just wanted to remind you that's slide 57 in our ACE interface slides is where I think there's about 6 or 7 slides that walk through the community capacity development process. So, now might be a good time if you've done a few of the base near presentations. I know I've had people say, okay, that's great, but now what? So you might take a look at these slides. This is another way of visualizing the 4 processes of leadership expansion coming together, shared learning, decision making, and they talk about how, at least in Washington, how these phases really propelled each other. Success in one phase led to success in another phase. So it's really sort of an ongoing rhythm of engagement. I'm just going to flip through these real quickly. These are the slides that you can use. This one talks a little bit about leadership expansion, and basically in high capacity communities, which is what we're hoping to create here, anyone who wants to be a leader can be a leader. And so we need to open up opportunities for that to be possible. And I think about John Muir, he may have not been recognized for the leader he was today had it not been for someone who created that opportunity for him. Oscar is going to give you some examples of some great folks that we've talked to in our community that are doing this right now. Coming together, this is the basically around creating expectations, creating spaces where people feel safe coming together. In Washington, that is the way people expect that things happen. Decisions aren't made, if people start rushing to make decisions in a different way, they say time out. They expect now that this is how decisions and processes are made, that they're going to be a part of dialogue about issues that are important to them. And we heard from Brian Farragher at our last session about the sanctuary model. So I'm just reminding us, and there is a slide on this as well, how important that is. And so when we're coming together, just to be mindful as we're setting up our processes, to think about the elements of safety. I had it here. The physical, the psychological, the social, and the moral safety. Let's see. Okay. And then shared learning, which is what they've experienced in Washington through this model, is that by learning together, it naturally leads to people sharing and then generating new opportunities to help one another or to pitch in resources towards common goals that they care about. The Washington Policy Council that supported Cowlitz County as well as many other communities up in Washington, they found the near science and the language around that was very powerful for getting people to think about problems in a different way. So I think that's going to be a really interesting topic for us to figure out how do we bring that up? Do we lead with it? Oscar and I, as part of our project, have been trying to weave together and invite different groups that we maybe don't normally work with in health and human services. And so I'm not sure about that. If you lead with the near science, do they go, oh, I don't know what that is, that's not for me. So I think it's an open question around how do we use this information. In Washington, they really led with it. It was part of their model, and they found it very effective. Decision making. Skip that one, excuse me. The last phase of their 4 phases is around decision making, and that's basically in high capacity communities, there's no blame or failure, just opportunities to learn, see what worked, see if we're on track, and adjust if needed. As people make decisions and learn together, they develop a sense of belonging and shared identity. And so as as I mentioned, they have found it really creates this ongoing virtuous cycle of getting ready for to continually becoming stronger and stronger as a community. This last slide here is around cultural respect and continuity. And it's not, I think it's woven throughout. It's not its own process or step in the process, but as they went through these processes, they found that they were able to really dig deep into the human experiences that have shaped their culture and their past and influenced their present. And so every community is different. Every community has its own trauma history. And so therein lies a survival history. And so that's something for us to think about, is how do we weave in our own cultural histories here. We have a lot of different people that have come together, and how do we highlight those stories and use those to help us remind ourselves that we're survivors, regardless of who we are. And then lifting all beings, this is sort of confirming what Roosevelt claimed. And this is certainly at the heart of the self-healing community model that, if we just as like they say in here in the slide, as a rising tide lifts all boats, a high capacity community lifts all beings. And the results in Washington are very compelling. The communities there, and not every community made it to this highest level of capacity, but they found in those that did that they really had reduced levels of ACEs. And I think that's something that we're all very interested in doing, is how do we prevent what's predictable is preventable. And so I think there's a lot for us to think about to see if we possibly could borrow from some of these ideas in the self-healing community model. So at the same time that I was learning about the self-healing community model, I was invited by Dr. Carmen Navarez from the Center for Health Leadership Practice to pull together a cross-sector team from Sonoma County to work on a project of importance to the public health. And so I couldn't think of anything more exciting or relevant or timely than this idea of looking at the self-healing community model. I wanted to think about how I could bring together people from different sectors who maybe were working on issues of connectedness, but maybe in a different way, and see if we could figure out how to boil down, first of all, build trust between each other, and then boil down some of this information in a way that could unite our different resilience communities. We called our project Building Equitable and Resilient Communities. And I talked to a number of people, I think probably in the last summer. I've talked with some of you, I'm sure. I was running around town with this article just because I was so impressed with it. And so I had a lot of people who were really interested in wanting to work on this. And ultimately, we had to have a small team of 5. So on our team, it was Oscar, myself, and then Trayton Heckman, who's the executive director of Daily Acts. And I had worked with him in the past, mostly on food system work, food system issues. We were co-founders of the Food System Alliance with a group that came out of Health Action. We worked on the iGrow and the Community Resilience Challenge. So I had worked with him mostly on food and environmental issues, not on anything remotely related to this, but I thought that would be a great way to bring in that whole perspective. And then Susan Shaw, who's currently the executive director of the North Bay Organizing Project, she was part of my personal network from volunteer work I'd done at the Grayton Day Labor Center and as a neighbor. So bringing in someone from that side, and then Nancy Dobbs, the CEO of KRCB, who I had worked with previously in Health Action and had specifically worked on projects around community capacity building and storytelling. So Oscar's going to tell you more about our process in the second part of the presentation after our break. And then you saw this slide already in Nancy and Sue's, but I'll close with this because it is sort of where we end up when we are finished learning about the self-healing community model, in that it is up to us. And so our project and what we've been talking about over the last year is, can we do what they did in Washington? Could we change our theory of change here in Sonoma County? Could we use those same principles and processes or adapt them in a way that worked for us to really be more resilient? how do we create the space and support and flexibility for this kind of transformation? I think about that a lot, being part of the government, where we have rules and processes, and we give out grants, and things are sort of structured. And I myself, we receive funding from state and federal that's very siloed. And is there a way that we can braid things together or create a little more flexibility so that we can actually do what the community believes they need and want, rather than what we think they need or what our funders think they need? How do we create stronger networks of connection between all these initiatives and coalitions? And I remember we, as part of the ACEs Connection Group, spent a whole day on a strategic planning meeting, and we were talking about the definition of resilience, and it dawned on me I had that same conversation about 6 months earlier with a more environmentally focused group that I was on, and it was the same conversation about resilience. And again, it comes back to connection. So how can we create stronger networks of connection between the existing groups? So that's sort of what we're puzzling with now. And I think I'm gonna leave it there. Oscar's gonna tell you more about our process and our initial findings from our CALEF, California Leadership Academy for the Public's Health. And thank you very much.